Hey, people can hear us?
Yeah.
Hello out there. Yes, anyone out there ready for a live program by Bob and Brad, or I should say Bald and Brad? I mean, Mike.
Beautiful and
Mike
Brad.
is here. Yeah, beautiful. Yeah, today's topic, if you haven't seen already, 20 low back and mid back fixes. Very quick relief. We got some nice, simple techniques that will help your back, and sometimes immediately. We've experienced it ourselves and with our patients, and all good information that will bound to help you one or the other. So Mike, are you here?
I am, but I'm trying not to burp into the microphone.
Yes,
So.
he's still preparing. He got on a horse a little late this morning, and then the saddle fell off, and all kinds of things
It
happened.
was more of a train than a horse, but
Well,
the same thing.
yeah, it's all the same time of year. So, anyways, we got 1 minute before we get the big introduction. Wow, my back is feeling good. I've already done some of the techniques that we're going to show. I did the hanging. We're going to show the mid back with the rolling, which I use on a regular basis with great success for maintenance on my back. I feel strong like bull. Mike, how do you feel?
I feel great. My back's been fine lately. And Terry, the timer is counting down to when you can see us, so that's why you
good.
can't.
Oh, yeah, that's right. We've got people come in and let us know where you are at if you'd like. It's always nice to know where you're coming from, what town, what city, wherever it is, what planet. You never know. It's all good here at Bob and Bald, no,
Bob,
Mike.
Brad, and Beautiful.
Beautiful, yeah. Yeah.
Bob, Brad, and Bald was the one.
Oh, yes.
Well, 5 seconds to the theme song. We better be quiet.
Oh, 5, 2, 1, go!
The two most famous
There you
physical therapists on the internet.
Canada. That's all right.
And we're here, and you're staring at the screen very close.
Yeah, there's people from all over the world. Thank you. Welcome for coming into the beautiful little town in Minnesota. Oh, there we are. I'm trying to read them. I got my glass issues. I got to get my cheaters on, get close enough to the screen. It's an aging issue, gray hair, but the back also ages. And we're going to talk about stenosis, which is very common. Over 50% of the people over the age of 60 have some form of stenosis. It's not a big deal. We're going to show you how you can manage with it. I have it myself and do quite well. Mike, can you talk about yourself a little bit?
We're also going to talk about sciatica problems, so not just stenosis. Not all back pain is created equal. Certain movements will bother one person while helping another. So with all of these, if you're not sure what your condition is, try them out. If it feels better, keep doing it. If it feels worse, do not do it. It's kind of like saying I have back pain is telling someone I have leg pain. There's numerous joints, numerous areas, numerous problematic spaces. So not all back pain is created equal. Just keep that in mind.
That's right. So we are going to start out with sciatica. You can certainly ask questions. If it's a broad question, it might be hard to answer. Just and there sometimes it gets to be too many for us to get all of them. We'll do what we can, and hopefully that the answers will apply to you and other people watching. So, big warning though, with sciatica, if you have sciatica pain down the leg, tingling, muscle weakness to the point where you're having problems with that leg, you're not going to watch this to get help. You're going to need to go to the doctor and get to the physical therapist. When you have weakness associated with sciatica, the leg gets weak, it needs attention medically. So we're talking about not so serious cases here.
So the first tip for sciatica, we're going to go through 4 different tips, and then we'll get into some other conditions, is actually just stretching.
Opening the door. Just open the door.
Yeah, open the door and my back pain's gone. Walk through the doorway and you forget. The first thing is actually stretching your back out, decompressing the spine. Brad, do you want to show them what spine and decompressing means?
Yeah, that's a good
so I'm
thing.
Not speaking Spanish to them.
There you go. So we have the spine here. Now, this is primarily for the low back, but it does decompress the thoracic or the mid back between the scapulas. If we look here, let's say, for example, we have a little bit of a bulging disc right here. So it's on this side. He's going to stretch on the side that has the symptoms or the pain and just watch what happens. Things start to separate right here. You got a good view of that, Tanner? Thank you. And that allows that bulge to reduce or go back where it's supposed to, taking pressure off the nerve, therefore less pain. That's why it happens very quickly. There's other options, and we'll show you that. Is that good enough?
I did, but I just realized we forgot to turn TikTok on. Anyway, this is a fun day.
You want to get that? Okay.
So for one-sided back pain, stretching with sciatica, you can go to a door. You can also use a stick, Brad will show. You can also hang from a pull-up bar or whatever you have at your house as an option. But say my right side is really bothering me, a way to decompress it is grab the top of the door frame or bar or stick and slowly bend your knees, elongating that spine, getting some decompression in there and getting that
right there.
Pinching off of that herniated disc you're having, which could be causing your sciatica. With this, you can just hang out here for 15 to 30 seconds and then relax. We realize some people, they can't reach this high because they're too short, or maybe they have a bad shoulder. So you can certainly do this with some sort of stick or broom handle, mop handle, whatever you have available.
Right.
But with this, especially if you're having a lot of pain, you don't necessarily just want to hang and bring your feet all the way off the ground. I can't hang on a door frame like this anyway. I would tip this one over, but at home you'd probably rip it apart. So to do a full hang, we'll show it in a little bit. You're going to need a sturdy object.
Right. And when this technique is being done, it should relieve the symptoms, particularly in the leg. If they get better as a result right away, you know you're doing the right thing. Now, you could be having some other symptoms, and if you hang and it makes it worse and makes the pain or symptoms down the legs worse, stop. It's not for you. Wait until we go to another technique. Now, Mike mentioned you can use a stick. I use a Booyah stick. You can certainly use a pool cue, a PVC pipe, 4 to 5 feet long, something that's fairly sturdy, and it should have a rubber end. If you don't have a rubber end, you simply take your shoe, because it cannot be sliding around on the floor or the carpet. And if you just put it in your shoe, you'll be fine. In the seated position, sit up nice and tall, shoulders back. We're going to decompress the right side. Pain is on the right side of the back, down that leg. You're going to reach up as far as you feel comfortable and gently go in, and you'll feel some stretch on the right side. Now, this for me is a little bit low. I need to stick a little bit higher. What I can do for that is simply go to a countertop. I'm going to actually do it the other side just for ease of filming. This becomes my involved side or painful side. Then I can reach up here, and palm is always tore away from you, back of the hand. You should see it. I'm going to hold on to the stick and just drop. Exact same stretch as there, except for you're using the stick, not the door. If you have a pull-up bar, now we don't have a pull-up bar, but we do have hanging handles, anything that you can grab above your head, and you're going to do that again, painful side. And we're going to go down, decompress that painful side again. Take your time with it. Again, you should feel relief. It should feel good right away. If it makes it worse, it's the wrong thing, stop, and we'll go down to some other techniques.
With the pull-up bar or the hanging handles, you can do both arms. You don't have to just do one.
We're going to actually show that later, too.
Well, I know, but it was number 4 on sciatica, so
okay,
get into it. We're over here.
And I do this for maintenance on my back. And actually, the other day I was using the chainsaw cutting the tree up, and I needed some treatment. So I was hanging on a daily basis, actually 2 or 3 times a day.
Now,
always felt good for
Mondo
me.
said he's 6'3". What should I use? All you do is bend your knees more if you're taller. You don't have to use something taller off from the ground.
Right.
So.
As a matter of fact, you do not want to have it so tall you have to reach up for it. Get a stool if that's the case, if you're short.
I mean, if your back pain's minimal and you just do this for maintenance, you can actually lift your feet off the ground if you have the strength to do that. That's not a problem. But yeah, whatever you can hang from. Just bend your knees if you're too tall, because then you hit the ground.
I'm feeling a little taller. Yeah, decompression of that spine, one-sided, like Rick talks about, and it can work when you do both.
We're on TikTok now.
TikTok, thank you.
Set up.
Sorry that we were a little late.
We're talking about
yes.
20 back pain tips.
What number are we on?
I think we're going to do some prone press-ups.
There you go.
We kind of talked about hanging and the doorway and the Booyah stick. So the next one, now this is more specifically tailored towards sciatica, or if you have a herniated disc or bulging disc, whatever. condition you were told you have. So often for this, what can help is doing a prone press up. So if you're able to tolerate lying on your stomach like this is where you begin. Some people, this may be enough and they don't want to go any further, and this is all they can tolerate. That is fine. Eventually, you want to try going just to your elbows and sitting here. You can do this for like 30 seconds or so and then go back down. Just work on extending your spine backwards. What this can do is if your disc is herniated backwards, sometimes it can help get it back in place where it needs to be. So that's why we go into extension like this. Eventually, over time, which could be the same day, it could be a couple days, everyone kind of varies, is you want to try to press up a little higher each day. But notice my pelvis is staying on the mat. You can do this on the floor. You can do it on a bed if you want, I guess. The bed might be a little squishy, but work on actually pressing up into extension and holding it there for a few seconds and then coming back down. Not everyone will get this full motion right away. Maybe it's just partial range. If this is making your back pain worse, no matter what, every time you do it each day, then it's not for you. Yeah. However, if you are having a lot of pain radiating down into your leg, but then you notice later in the day, oh, I feel it more in my butt or my low back, but it's not going all the way down my leg. Is this good or bad? That's actually a good sign because it's working its way up your leg, even though it's more intense in that one spot. So stick with it and it should improve.
Right. And I'm actually going to give you a little more details on that. When the pain or numbness or tingling is down the leg, let's say it's to the calf. I've had this many patients. I'll have the person lay down on their stomach first. And if it's like, oh, that's still a little uncomfortable, can you lift up? I'll put a pillow underneath their stomach. Oh, that feels better. Now my leg is feeling a little bit better, 30 seconds, 60 seconds, and it'll go this fast sometimes. Then I say, let's progress to without the pillow. Oh, that hurts a little bit, the patient might say. Still some pain down the leg, but only to the knee, not down to here anymore. Lie there for another 30 seconds, and all of a sudden the leg starts feeling better. Anytime the leg starts feeling better, that means the herniation is actually reducing or going back into place. And then when it feels comfortable, do this. As Mike mentioned, the next thing is up on elbows. And sometimes a static position like this will be good. And other times you may have to have some motion involved and do some mini push-ups. There we go. Just halfway up. And you'll just start little bitty ones. And at the first two kind of hurt, and particularly more in the back, but the leg's okay. Go a little more. And if you, by the third or fourth one, oh, it hurts more in the center of my back. Boy, you're doing right on the money. Robin McKenzie, a famous therapist, came up with this technique, and I've used it many times in the clinic. And then once you figure out what works, you may do this every 2 hours, as long as you get the symptoms come out of the leg, and you can have a resolved problem go away in a matter of 2 or 3 days if that's the real issue that's going on in your back.
Some common cheating I see with this exercise is they start going up and their whole pelvis pops up and you're on your knees. This is not extending your back. You're just lifting your legs up. So make sure to keep your pelvis or your front of your hips in contact with the ground or mat. You're just working on that extension phase.
I'm going to block this here.
Quit blocking me.
Sorry, Mike. The next thing, which is oftentimes the problem why people get a herniated disc, people think, oh, well, it's because I'm lifting too much weight, which is definitely a problem, but posture while you're sitting with poor posture over time, not just one day, but over week after week, month after month. You don't even realize you're sitting like this. We need to get good posture. I've had people with back pain just simply change their posture by taking a pillow, putting it behind their back, and getting good posture, and the pain drops in half just because of changing the posture. Sometimes a pillow here like this will work, a regular bed pillow. Sometimes you need something more specific. I don't know if we got that towel roll. Usually I have patients take a towel roll it up, put it behind their back, and ooh, this is a big one.
Yeah, that's a big one.
But so a little bit smaller would probably be appropriate. And then you put that back there and you will find out, you'll get it in one spot. It's like, oh, that really feels good. That's the size of lumbar support you're going to need. You're not going to need it for the rest of your life, probably. It's one of those things when your back gets better, you're going to change your posture, scoot your bottom back and sit nice and tall. They make all different kinds of shapes of lumbar rolls. This one's a half moon, they call it. This is a full circle. The density can change. If you're a bigger person, you probably get a bigger roll with a little more density. You do have to play around with that. I have a specific back support that I've found that works for me. I use it in my car, on the lawnmower. And it really changed my life as far as seated comfort for long-term driving and bouncing around on the lawnmower.
We got some questions that
Oh,
don't
yes.
pertain to back pain. So just FYI to everyone, we're focusing on back pain today. We did have some on back issues. Someone was asking about SI joints as well. Some of these tips help with SI joint pain, but some of them don't. It's a little different.
Yeah, SI joint pain and back pain, they overlap a little bit. So maybe we'll talk about that when we get into some exercises.
We can link a video. Chelsea at home, if you want to find a SI joint pain for Kypra that you could link that she could watch, that would be beneficial. Thank you.
There you go. Yep, absolutely.
Other than that, there was a few questions about like arthritis in the back. A lot of times with arthritic backs, just movement, what is tolerable for you is good. Oftentimes being sedentary will just make things worse. Stuart McGill even says walking is one of the best things for your back. It helps lubricate it. I actually saw a patient yesterday who was having back pain, was doing fairly well for therapy, an older gentleman. And today he said, I'm just feeling terrible. And I was like, what'd you do yesterday? Well, I did absolutely nothing. I had a migraine and I laid in bed all day. And I said, well, yeah, it's why your back hurts. You didn't do anything. So unfortunately, when you have a migraine,
yeah,
take what's best for you for that day. But just saying movement in general is still good for your back.
There you go. Again, arthritis in the back, you got the facet joints. So let's take a look at them. How do you get arthritis in your back? Muscles do not have arthritis. It's these little joints are called facet joints. Arthritis is always where two bones meet. There should be cartilage in between them so they're nice and smooth. And there's each disc or each vertebra has two sets of facet joints. That's specifically where you get the arthritis, from in the low back all the way up in the thoracic back. And we need to keep those joints moving without stress on them. So you're not going to go out and do a lot of lifting and get motion that way. You want to do it without the stress, doing some exercises that feel good. Walking actually does a fair amount of movement in the low back because of your pelvis. When you walk for associated with back pain, you want to walk on a flat surface. Don't go up and down hills, certainly not hiking on an uneven surface. So a nice controlled surface is really helpful for walking in relation to back pain. Whoa, what are you doing, Mike?
We're getting ready for some of the next tips.
Wow.
We did have a question about
Okay.
how do I release the psoas? Now, the psoas can connect to back pain if it is very tight, because what it can actually do is it can tilt your pelvis. It connects in the front of your pelvis and your low back. So if it's tight, it can shift your pelvis anteriorly. So this is neutral. This is an anterior tilt. You may see those people that walk around with their butt sticking out. Normally, this happens more as you age. Younger people normally don't have this problem because it's not as tight. But you can do some hip flexor stretches. Otherwise, there are tools like a PsoRite or other products that can release in there, or just seeing a massage therapist. Most of them are trained to how to release it. It's a little uncomfortable because your psoas releases lateral to your belly button way up here if you're actually releasing it manually. But just look up hip flexor stretches. Those can really help.
So look at this one. It's a hip flexor, like Mike mentioned. They connect to the lumbar spine, and this muscle actually goes deep. It's really kind of under your abdominal content along the pelvis, and when it contracts, the hip flexes. So it's part of when you go upstairs, when you bring your knee up, the hip flexor, the psoas, is active and responsible for that motion. But when it gets tight, the pelvis can anterior rotate, just like Mike went through.
So we're going to go over some quick tips if you're having now just acute back pain. You don't know what happened. It just happened this morning or yesterday. It's not getting better. I need some relief because everything is uncomfortable. That's kind of what these next three tips are for. So the first one is just getting comfortable, laying down, elevating your feet, and possibly even getting a cold pack ready. Brad, can I have my wedges and pillows?
Well, yes. As a matter of fact, I was trying to read another comment, but we need some assistance here. This is something I always did with a patient when they came in, and they were really uncomfortable, and nothing was fun as far as movement. I couldn't do any exercises because it all hurt. So what I would do is take either a couple pillows and put it under their legs like this. Typically 90% of the time they say, oh, that feels better. And then I would have them lift up if they could, take a cold pack, put it underneath a gel cold pack, their back, and it would be a little, ooh, that's cold. And after about 30 seconds, it's like, it's cold, but it actually feels good. Cold has a nice, the muscles response to cold deep after it's been there for a while, and the body and the mind is adapted to it, becomes a relaxive, it makes the muscles relax. I got stuck on a word there. Now, this thing as I always have in the clinic, I used to have one at home, but my wife didn't like it anymore, and I didn't need it so much anymore. Put that there, and that supports the hamstring area or the femur in here. Something about the angle of this and the support. I've always had really good luck. I've had a number of patients say, I want one of those. So I'd say, go on Amazon, look up leg wedge, not just wedge, but leg wedge, and you can purchase one of these if you want.
Make sure to read the dimensions, because if you're really tall, you might need a longer one.
This dimension from here to here has to be the longer one. And I think you can get different height this way as well.
Yeah. There's lots of options.
Now, the other thing I've done, some people just don't tolerate cold packs. Get a hot pack and put it under there, and there you go. Sometimes with a real acute injury, it's very tender, and they're just really tender. I don't like to use hot packs, more so if it's a few days old, muscles are tight, and get some heat on them, and they can relax.
Yeah, I often use hot packs if my back's ever been bothering me. I just use an electric heating pad. This is a far infrared heating pad by Thermatex we have right here, which actually penetrates quite a bit deeper than a conventional one. They're pretty handy, but they are expensive, so you can keep that in mind. But you could certainly use a gel hot pack, whatever you have available. I find if you have like arthritis in your back and it's not an acute issue, heat normally feels better for those people.
Sure. Yep. Christy, she's talking about lower back pain when she first gets out of bed. What I'm going to suggest to her, Christy, is if you haven't tried this while you're still in bed, before you get out, Liz, can you show her the single knee to chest and double knee to chest?
And then some low trunk rotations.
Yeah.
So single knee to chest is just bringing your knee up towards your chest, leaving one leg flat, one leg comes up. You can use some overpressure with your hands. If you can't reach this far, I don't know how much motion you have, you can certainly grab under your leg. If you really can't reach, you can use a belt or bed sheet to grab up and help stretch. But just bringing one knee to the chest, hold for 15 to 30 seconds, and then switching to the other side. Most people feel pretty comfortable doing it one-legged. If you don't have any issues with this and you want to save some time, you can certainly do both legs at once. It's not going to hurt anything. Notice my back is flat against the mat here or in bed. I'm not bringing my knees up to my face. We're just getting kind of a gentle stretch here. Again, you can do 2 to 3 sets of 30-second holds. And another one to get some rotation going in your spine before you get up is bending both knees like this and then just rotating side to side. Some people could go all the way down, no problem, to the bed. Some people are going to be a little tight, and maybe they just go a little bit of motion and limber it up. Usually 10 to 20 repetitions each way with this can just get that spine moving a little bit before you get up, but it doesn't hurt as bad.
All right. So, Christy, I just want you to keep in mind while you're doing these, if they should feel good, should feel like a good stretch. If you're doing the knee to chest and it actually increases pain in the back, or it makes it worse once you get up compared to when you didn't do it and walk around, then it's not the thing to do. This should be something. And, without an evaluation, I can't tell if you have any kind of extension or flexion discrepancy. So we're just going by what we can do by what you're describing on the view, which is, limited as you can understand.
I did see someone said they had ablation, burning, cauterizing the nerve endings, and it didn't help much. Unfortunately, sometimes they don't get the right spot. Sometimes the back pain is actually coming from somewhere else, or your muscles just may be tight and you have limited range of motion. So it's important to still do some exercises and strengthening as well. just to try to get rid of some of that back pain. Because I mean, I've seen people that have had back surgery more in depth than just that, and it didn't do a thing. I've worked with some people and it did a lot. So just, it's good to still exercise and strengthen and stretch even if you've had surgeries, as long as it's allowed and you're not breaking precautions.
Right. So it's like every other joints in the body. Movement is going to be healthy for it as long as it doesn't irritate it. So that's the therapist's job, is to figure out, which movements are tolerated, and then we can work into all of them. And so that's why there's 20 different options here. Every back pain is a little different. Some are clearly different, like stenosis versus a herniated disc. They have usually opposite exercises to improve their symptoms. So that's the concept to keep in mind.
Some people are asking about injections. Talk to your physicians. We're not big into injections. Like, this is not our wheelhouse or knowledge base. Some are cortisone, some are other things. There's lots of new options out there. Some people I've worked with have had them and they helped a lot. And then they do therapy in conjunction with them and see if they can resolve their issues. Sometimes the injections will help along with therapy. Sometimes the injections help, but then they wear off after a while, and then they're back to square one. Sometimes they get injections and they don't notice a difference at all. So I can't say, do it or not. It's up to you, but it's an option that's less invasive than surgery, at least.
Right. And if your doctor is talking about injections, you might want to say, and you haven't had therapy yet, can I try therapy before the injections? And you discuss it with the doctor. Sometimes they'll say, well, yeah, that's a good idea. Sometimes they'll say, maybe we can combine it, do the injection so you tolerate movement more. So injections you really need to communicate with the doctor who's putting it in.
There's a lot of different questions there. We'll get into some of the other tips and then try to go through some more questions. Next, we're going to talk about stenosis.
Stenosis.
What's stenosis?
Well, we've mentioned it before, and we'll give a little more detail. Do we have a pointer over here?
Well, a pen, yes.
Yeah.
I don't know if it's a real pointer.
Yeah. Anyway, stenosis. You can have stenosis in your back. You can have it in your arteries. You can have it in different joints. Stenosis means there's a foramen or a pathway, a hole that is actually shrinking in size. So when it comes to low back or thoracic, you can get it in your neck as well. The nerves that exit the spine that come from the primary spinal cord, it's called a foramen. The hole where the nerve exits actually gets either bone spurs, scar tissue, whatever it is, gets smaller, and it actually can start pinching the nerve. Now, with stenosis, it can come from the discs actually getting degenerating with age. That's why I mentioned before, I just read a book on stenosis last night, and they talked about everyone typically over the age of 60, 50% of them have some degree of stenosis. So it's not the end of the world. It depends how severe it is. So anyways, those holes tighten. Now watch what happens. Can we go right in on this where my finger is? Look at that nerve. Now, when I flex forward, this is a little exaggerated. It's not exactly like this, but the concept, the hole or the foramen opens up, taking pressure off the nerve. And when you go like this, it tightens up. That's why with stenosis, if you bend forward or sit down and the pain goes away very quickly, it's a very positive sign that you have stenosis. So there's specific exercises to try to open the gap and keep it open. And then anything going backwards, like if you're working overhead, washing windows, or working on the ceiling, anything where you're even walking long periods of times, the back gets worse. Sometimes you get the symptoms down the leg, and it's a form of sciatica, but it's from stenosis. And then if you sit down, I know because I had this a few years back, I'd sit down, feel good right away. Then I could get up and walk a little more. Usually as I was walking on the road, I would just go down like this, open up that gap, feels better. And I would just kind of stretch like this for 30 seconds or so. I could get up and walk some more. I had stenosis where it went down my leg at 3/4 of a mile. I had numbness in my leg, and I worked it out through some exercises. Should we show? Actually, we've already showed some of them.
Yeah. Cindy asked about a herniation and arthritis. Cindy, you can rewind this live video. We just talked about herniations and sciatica. So just go to the prone press up section where I'm laying on my tummy pressing up.
Yeah.
If you want to look at that. But
Or even the hanging the prone the Rick technique with the stick or the
we kind
door.
of hit that subject matter already. We're on stenosis. Now, what are we talking about stenosis?
Stenosis, we're going to quickly go through it because he showed it. A really common exercise that helps with stenosis is lying on your back. You can do it on your bed or on the floor. It really doesn't matter too much. Whatever works best. Usually the floor, just because it's a little firmer. And just a single kneaded chest or double kneaded chest.
So just flexion.
Yep.
Because you're actually flexing your lower spine, opening up the foramen, as Brad was talking about. I don't know why. I always think of Foreman and I think of Foreman and George Foreman. I don't know why, but
yeah, that's kind of interesting, Mike. You have an interesting mind.
That's how I remembered it in school. George Foreman, Foreman. There we go. So just stretch, hold it for 15 to 30 seconds on each side. If this feels good and you can do both at the same time, go ahead and just bring both knees to chest. Oftentimes that flexing posture, or like I had earlier, the big leg wedge pillow underneath me to be in this position for a prolonged period of time can help. But Brad, do you have some other tips of going up and using a wall?
No, actually, that's for the next part.
Oh,
Yeah. But other things for stenosis, typically, if you've got stenosis in the low back, sitting down feels good. And then actually stretching forward like this feels good for me right now. Whoa. And, another point is this feels good, but I'm not going to hang out here for a real long time. We'll do the stretches, maybe 15, 30 seconds max. I actually go 10 to 15 seconds. Feels good. And then I go back. We want the motion. If I were to hang out here for 3 or 4 minutes, then I would have some pain because it's end range. It's really overstretching, which can be done. So use good judgment, do a little bit, see how your back responds. Oh, we got the big ball. One of my favorite tools for back problems.
If you're uncomfortable bending down to the ground because you're going to fall over and you happen to have a ball, or you have availability of one at your gym or therapy department, whatever, you could certainly use that. I do this exercise with patients a lot that have some stenosis and back pain. So you're still flexing your spine and they just kind of roll forward, roll backwards, and it feels pretty good for them.
Yeah.
And it gets some little hip mobility in there too.
This is what I'm sorry, Mike, you were right. I had one more thing. And this works for stenosis, but it can work for other back pain too. So if you're having some central,
sometimes SI joint pain even.
Yeah. Back pain here, and maybe even down the leg. You simply go up against the wall, put your feet out about a foot, maybe 16 inches. Make sure that you're not, if you have socks, you're not doing this on a slippery floor, because if your feet slide out, it obviously is no good. So you need to have a solid foundation, grippy shoes, grippy contact between the feet and the floor. And then what I'm going to do is there's an arch here. There's a little gap there. And I'm going to tighten my abdomen muscles and flatten my back. And if that feels good immediately, that's something you need to do, or you can do on a regular basis when you're standing. And I've done this many times where I'll be standing, my back starts to get sore. I'm talking to someone, I'll go up against the wall, keep talking, and then they don't know what's going on, and I'll flex and I'll make that back feel better. And it is my stenosis that's bothering me, and I don't get too excited because this is one of the things that helps my back. I also do the exercises that Mike showed as well for maintenance. Once you get it under control and you know what your body responds to, you continue to do it on a daily basis. All right.
Sherry says she lays on her back and do back bends, but she's asking about the ball. I'm just confused by what she means. Anyway, Sherry, if you can explain that more in depth, I'm not sure what you mean. Do you lay on the ball on your back and do back bends like a crunch? I don't know what she's, or if she just meant she's laying on the ball and her back and the ball has nothing to do with it. I don't know.
Well, I guess if
it's not increasing your back pain and it feels good, then do it.
Actually, that's true. I mean, the question I have there are, when you're lying there, are you facing towards the ceiling, or are you lying down stomach on the ball so you're facing towards the
she's
floor?
Laying on her back.
On her back
with the ball.
Oh,
I'm guessing you're talking about a crunch. Is she just going into extension and flexion like this? I'm guessing.
Yeah.
Is this what you mean? into extension, then flexion. I mean, if it feels good, that's fine.
There you go. Yeah.
Doing a crunch and going into extension.
The nice thing about using the ball is you can get motion and the back is supported from the ball. And I can do a lot more exercises using the ball to strengthen my back than I can without it and have zero pain.
If you're not comfortable on a ball and you're an older person, make sure you feel steady because they do move around a lot and you have to have some balance.
Yeah, there's definitely a learning curve, but that's a benefit from them. Actually helps your balance indirectly.
Arms backwards.
All right.
Towards ceiling. Yeah. I mean, that's fine as long as it feels good on your back. One-sided back pain. Well, some of this we kind of talked about with sciatica because most of the time sciatica is one side, not always. But just doing a one-arm stretch hang. You could do it with a stick or doorway. We show this right away in the video. Do you just want to show on the...
Sure. So again, the pain is here, not running down the leg. It's not sciatica. It's here, and it stays on that one side. I just had a bout with this last week when I was, like I said, I was using the chainsaw, overdid it, but I was having fun, you know.
What were you chainsawing?
Big tree. My brother fell down, and my brother's already calls me up. He texts me Sunday morning at 9 o'clock. You got to come help me cut the tree.
I want a Texas Chainsaw Massacre issue here.
Well,
so just making sure.
This is a family show. Get that out. So this is what I did. I have one of these at home because I do hang like this, but one-sided. I'm going to take Rick Olderman's advice and stretch. And when I did that, it's like, oh, that feels good. Even got a little popping going on in there. It did not fix it totally the first time, but for the next 2 or 3 days, I would go and stretch one side. You can do it here. You can do it with a stick like I had showed before. Again, while you're doing it, should feel like good stretch, not irritating it. And then after you're done, it's like, oh, that's a little bit better. Then you can continue to do it. What are you eating something?
No, it's the Velcro. I'm trying to get my massage gun.
You know, sometimes we have issues here behind the scenes. We got characters that, you know, I gotta have to put up with. Actually, he's going to talk about using a massage gun on the low back with an airhead, so it's soft and squishy. Go ahead, Mike.
Yeah, so there's lots of different options of actually working on your mid to low back to massage the area. We're going to talk about a lot of different options here, not just massage guns, but it's the first one. So a massage gun can help. If you know a masseuse or go to massage therapist, chiropractor, that's fine to have them do it, or your partner, you can do that as well. I often find trying to massage your own low back or mid back with your hands is darn near impossible because you can't really dig or knead in there as you need. So just getting a massage gun works well for the mid low back region.
They can't see it on that shirt.
Well, fine, just steal it from me. Turn around. There you go.
You can see I can get there. Do not go directly on your spine. That is not going to do anything but cause problems. I can do it with this soft head if I'm gentle, but I'm going to go off to the side, right above the pelvis in that muscly area. And we're just going to work that. This is one of those things that it's not easy to do. My right arm is not real comfortable right now. So sometimes just using a ball of some sorts, a tennis ball, golf ball, not a golf ball, but usually
massaging. Ooh,
it is feeling good right though.
There.
Oh my goodness.
So if you're going to massage your low back, make sure it is some sort of soft or cushioned head. I have a nice little foam round head here. Brad had an air head, which is silicone and very soft and has a lot of air component to it. It's just filled with air.
It's squishy. It's not aggressive.
Use something really firm and hard, like this bullet head is going to be way too aggressive. Even this flat head, it's made out of plastic, is going to be too aggressive. There's a lot of bony areas back there, especially with all the vertebrae. So it's important to use the right massage head. The gun size just depends upon what you have available. Obviously, a smaller gun's not going to be as powerful as a bigger one. But when it comes to using a sort of ball you have at your house, you can do it on the floor, against the wall, whatever you have.
You know, I'm going to wait with this and combine it with the thoracic back because there's a number of things that a ball and that's you do it the same on the upper back or low back. So just hold on for that. And compression, we did talk about decompression. Because we're going to be done with the lumbar spine pretty quick, and then we're going to move up to the mid back between the neck and this area here, usually between the shoulder blades. So this technique works for, or can be really helpful on that upper back as well as the low back. And again, on a pull-up bar or hanging handles like we have here, you're going to just, with control, if the pull-up bar is way up there, you don't want to jump up for it. Use a good solid stool that you feel stable on. And it really works well if you can put your back against the wall, because it helps posture and it gets your body in a really good alignment. And it also works as a kind of a break. So when I let my knees bend, you can see I'm starting to decompress now, stretching. And a lot of times, like when my back was sore last week, I would only go about 50%. I'd still have my feet on the ground, stretch, and then I'll kind of move my hips around a bit like I'm doing a little hula dance and find out which way feels better. Usually if it's on the right side, I'm going to go down on the right pelvis. There we go. And as it feels better, you can go to more and more weight. So now my feet are on the ground, but most of my weight is through it, and it feels really good. It can be good for your shoulders unless you got a shoulder problem.
I think we should mention that this is the same concept as like an inversion table.
Yeah.
Decompression, traction are kind of the same thing. The inversion tables, you're often, your feet are strapped into a certain, well, they are strapped in, but you can vary the degree you go upside down.
Right.
Just with that, some people get a lot of relief, but you obviously have to make sure you don't have any precautions with that. Some people get very dizzy, lightheaded, blood pressure issues. So just be aware of that. But some people do get benefits from inversion tables as well.
Was Chelsea responding before? Because we've got 2 or 3 videos. We got the inversion table out. We go through the whole process, how to use it properly, precautions and everything.
Yes, Chelsea, if you could find that video, thank you.
Yeah.
Everyone say hi to Chelsea.
Yeah. Chelsea's in the background.
She got the
Okay.
SM
Yeah.
one.
She's
good.
She
at
is.
that
She
stuff.
is excellent. So yeah, if you could pull up the inversion table, how to use an inversion table, and put that up, that would be helpful if anyone has one. I had one for about 2 or 3 years. It was helpful for a while. Things got better, and I start using this because it was much easier.
Yeah, this is less expensive if you
Yeah.
could just hang from something. Obviously, inversion tables cost a little bit of money, but
All right. You know, we should go now because I am getting tired of talking, and I don't know about you, but we're going to take a little break and get to a little
a video clip in
yes.
the past, because
Yep.
everyone wants to see Bob in a video.
That's right. Mid back pain. Bob and I demonstrate how to use I believe we're using a 6-inch roller and a tennis ball or a lacrosse ball, which is a little more aggressive. So how's it looking, Danny? We're
Good to
okay.
go.
Here we go. This will take about 2 or 3 minutes. And this is a little faster typically. And it is direct muscle mobilization or a massage.
Yeah.
You know, if you don't have a professional masseuse at home that's going to take care of them for you, we're going to show you the other options. If you have knots in your upper back, this is what I like to do. As a matter of fact, we did a video on this not too long ago.
This might be more for knots and not as much as spasms. If it's spasm, I don't know if you're going to be able to tolerate this or not. You might be able to.
Yeah, and it's going to depend now. This is not a real hard roll. It's a medium density, so it's not as aggressive on those knots.
6-inch foam roller.
Yep.
And so I'm just going to roll. Now, you wouldn't do this on a mat like this. You do it on the floor.
Right.
Well, for demonstration purposes. And sometimes people like to cross their arms like this
Yep.
to get their scapulas or the shoulder blades out of the way.
Yep.
And you can really get into that mid-back then.
Now, if this is too aggressive, and it might be,
It
like
might
Bob
be.
had mentioned, then, we can, we didn't mention you could use a hot pack on the thoracic spine as well.
Right.
Using the same
And
rules.
you could use a ball like this
Yep.
too.
Now, that's a lacrosse ball.
That's a lacrosse
That's
ball.
pretty aggressive.
That's pretty aggressive.
You might want to start with a tennis ball.
or against the wall.
Yeah.
So you could, but you basically, I'm going to hit some spots here. Brad, do you mind coming over just so I can
Oh,
show where
sure,
I'm
yeah.
trying to hit? Usually we hit between the spine and between the shoulder blade.
Yeah.
Right in here, different spots on both sides. And by rolling onto that area, it helps mobilize and again, You have to determine if you can tolerate that if you have spasms. There.
Right.
You certainly can try with trigger points.
Yeah.
So.
You can do it like this. This is what Bob was saying. You can do it on the wall, and it's not as aggressive.
Yeah.
And once you get to that spasm, and if you want to work it slowly, and as you get relaxes, you can get more and more onto it,
Yes.
and get more aggressive, and you'll feel it release. And when it releases, it just feels good. I
Right.
mean, things are going
You're
well.
in the right direction.
Right. Wow.
We're back.
Oh,
on
hi.
YouTube too. We were
We're
showing
ba-
TikTok. Some
TikTok, I was not connected to that video, so I was explaining to them what we were explaining. I just got to using the ball. You can use a softball, a little bigger, not so aggressive than the lacrosse ball that I was demonstrating in the video there with Bob. And I'm going to work this. This actually, you have a little more control over the motion, I think, so it may work better. So just go down to the park and see if you can find a softball laying around that they forgot.
Another good option is if you can't get the right spot, you can put internet. Oh, we're back. Okay. The camera's back. It cut out here for a minute. Anyway, Brad's found a sock with the ball, so I think we'll just go to that now.
Now, this is a really long sock, and it has 2 balls in. Oops, there we go. 2 balls in. You can use it just with one. And anyways, that allows you to drop the sock in the position up or down. If you have 2 balls, you can actually get the ball on each side of the spine and work it. And just real cheap. Just get yourself a couple tennis balls, a nice long sock. The old, what do you call those, knee-high socks? Sure.
Maybe you got some compression socks out. Who knows?
Compression
Stockings?
socks. Well, we used to call them knee-highs back in the 70s with the stripes on them. That's what everyone wore in track.
Oh my!
They were
goodness.
cool.
You were fast then.
Yeah, not really. Anyways, so that works out well.
So you can use a foam roller, a massage ball. There's lots of different options like we're showing. We also have these biodegradable. I don't know. They're cork balls. Puts our name on it that you can find at Walmart.
Versus ones that are made out of plastic. These are injected plastic. They have
They
contour. What?
They vibrate.
They vibrate,
Yeah.
and they have a prickly surface. It's really, I like this. This smooth ball works well, like the technique I was doing. What I really like this for, Michael demonstrated how to use it on his back. Whoa.
I dug in there.
This is a family show, Mike. In other words, it feels good. Everything's under control.
Yeah, it's fine.
Yeah.
I laid on it pretty aggressively. Yeah, you can just mess around with how much pressure. Ooh, that vibration feels nice. Again, don't go on the spine, and you can get that mid back. I probably wouldn't do these on my low back. It kind of feels a little aggressive, but the ball feels really nice in this area. Ooh, it really digs in there in the shoulder blades.
It does. Yes, it gets right in there. So again, this might be like Mike says. You can feel that the surface, how it's rough, is. He likes it. Some people are going to say, "Oh, it's too aggressive."
Yeah.
Use the smooth ball.
These are by the pharmacy section.
Yeah, well, these are
By
at
the
Walmart.
Tylenol.
Actually, they say Bob and Brad
Or you
because
can get it online
we
at
like them.
Walmart.com as
There
well.
you go. You just push the button to get the vibration going.
And they come in 2 packs.
Yeah, 2 packs.
So you get both colors. So you don't have to
Here,
fight.
can I see that black one? Because
Sure.
I just want to show you my favorite use of this. I do it to back, but I usually use a roller. I really enjoy going on my feet on these, even my sock off, but I'm not going to take my socks off for you guys. But at home, I do with the socks off, and I like getting in the arch and around the toes, and the vibration is a plus for me. You can have it on or off. It doesn't have to be one of these balls. You can just find any kind of ball, softball, hard ball, something that the kids forgot to take to the park, whatever. All right. Are we missing something else?
We're going to
here?
work on some extension of
Oh,
the
the time
thoracic
is
spine.
flying. We don't have too much more time, and our viewers are, we got more questions to answer. I don't know.
Where's the kickball? Where'd our kickball
That's
go?
over here.
Oh, can I have it, please?
I grabbed it. Oh, here it
Oh,
is.
you made a mess.
Oh, here, the hook shot.
Oh, gosh.
Watch this. See that?
Wow.
Kareem Abdul-Jabbar.
So what you can do if you have some mid-back stiffness is actually work on going into extension versus flexion. Some people this feels better. You can take some sort of ball, just a little kickball, place it behind your back. Go to the area that seems painful.
Turn, Mike. Come on. There you go.
And you can go in the mid back or you can go upper depending upon where you feel tight. And you're just going to work against the ball, go into extension like this. If you have good shoulder motion, you can get your arms involved and just stretch back and hold it for a bit and go back down. And then I'm just going to drop the ball a little bit, work the low back as well. And you just get some nice spinal extension in a seated position, which feels really good. You can even hold it and just put your hands behind your back if you want and get a good stretch like that as well. If you have a forward rounded posture or you're kind of kyphotic like this, you sit at a desk job forward rounded, this is a really good thing just to do frequently throughout the day to give your back a break. What are you doing? You rolling in with a chair?
Yes, we've got a question from Monda. I hope I pronounced it right. She's asking, what is the best
Mondo.
Mondo, I'm sorry. Well, you don't know if that's the right way.
You don't have your glasses on.
Well, I know, but I'm doing my best. The best type of chair, this is a little bit subjective, but for sure, you're going to have to spend some money if you want to get the best chair. You're going to need a chair that has a number of things that goes up and down. It's good at the seat pan, slides forward and back, and tilts. There's a lot of different levers on these on both sides, so it takes a little while to get used to them. And another big advantage is a lumbar support.
Adjustable one.
Yep.
And a lot of them can go out more, in more,
Yep.
or up and down. So it can fit to your body better.
And then this is really important, that the armrests go up and down to fit your body. I went through a lot of different things, but sometimes a chair will just go up and down and have this, and it won't have the other adjustments. You can't customize it to your body quite as well. And that's okay. That's still a lot better than just a chair like that.
Now, if you're stuck in a chair like this, oftentimes I might just put a throw pillow behind my low back. That oftentimes gets me in better posture and fills in the gap in your low back when you're sitting. That's what I normally do. You can also take a long pillow and put it vertically if you want. Some people are kind of short and the seat pan depth, so the front to back, is too far for them. So you can certainly take a pillow, put it the long way back there, and try to make it more comfortable like that for your back if you're having some issues. A lot of it is just making sure your feet can touch the ground comfortably, you're in an upright posture, your computer is set up good with a monitor screen at level height. You don't want to be sitting on your laptop like this because then your spine's just rounded. So having good posture like that is what you typically want in your workstation.
Maybe Chelsea can pull up one of our computer workstations videos, and they go through all this in detail. People are maybe asking, what kind of chair is this? This is a Flexi Spot. We've had a number of them. They are good, and the prices are reasonable. You can get chairs for a computer workstation and spend $500, $800, and they're really cushy, but you do not need to spend that much. You can get one for $200 to $300. You have to do some shopping around. So anyways, that's what we've been working with, and we're happy with these.
Cindy just said if you have tingling in your arms and neck when you raise your arms up, well, you're having some type of spinal issues, but in your neck. I think she was talking about with the ball when I was doing it earlier. You can just keep your arms at your side with the ball thoracic extension if that's uncomfortable, or you can try it lying down with a smaller ball, because sometimes gravity then helps you bring your arms back. Or even, well,
what?
I can probably just show them
I do want to mention thoracic outlet syndrome. That can happen with this position. I wonder if Chelsea could pull that one up. We do have a video specific to
We're
that.
putting Chelsea to
Chelsea
work
is
today.
really working hard, but she's so good.
If you're really struggling to get your arms up without pain, you can try laying down on the floor first and just bringing them as far as you comfortably can.
You're lying on the floor.
I'm a liar.
There are some English majors out there, and they're watching and keeping track of us.
And work on just stretching out your arms and slowly kind of getting them up. If you're really tight and struggle, your arms might start creeping up off the ground like this, but you can kind of work on just some of your basic motions. If you have a really tight neck pain and can't touch the back of your head to the floor, then you may need to put a pillow underneath you and start with that way.
Yeah.
But it sounds like if you're having some issues there, you can just kind of try that. I know it's not really working on flexion extension a whole lot, but it can get some help with your thoracic and cervical spines.
Oh, look at the Evelyn has made a comment. I found myself curled over my dinner plate. Absolutely.
bueno.
Boy, that is one. What's no bueno?
No good.
No good is
Something.
right.
I took German. I don't know.
Slouched over like this. The best thing you can do for your children, if you got 2 and 3-year-old children, is when you're at the supper table. Of course, nobody eats there anymore. Sit up tall and make them sit up tall so this becomes normal to them. I did that with my daughter. She'd be in high school because she was so used to with good posture. People would kind of make fun of her and say, "Why do you sit that way?" It's like, it's good posture. Anyways, definitely helped.
They call her a nerd?
Well, kind of like that. And they say, "Oh yeah, your dad is Brad Heineken." That's an excuse.
Oh,
Anyways, it's getting to be a long hour here.
it is. I think we'll get into our last tips about sleeping with
Yeah,
back pain, because we
sleeping.
did have a question on that earlier, so I better clear off this mat table. We kind of talked about a little bit of it, but we didn't talk about why. Turn this thing on. Oh my
Now,
goodness.
I'm going to just mention this while Mike gets ready. Some people sleep in a recliner, and some people say you can't do that. It's not good for you. And that can go either way. Typically, the patients I've had that slept in their recliner without problems, they felt good. It's the only way they could sleep, as a matter of fact, is older people in their 80s or so. My mother slept in the recliner every night for the last 2 or 3 years of her life, and she was comfortable there. And it's more than likely as a result of some stenosis. As I mentioned, as you get older, stenosis can get worse, and the back actually likes to be flexed more than straight. Okay, Mike, go on.
So if you are a back sleeper and you are uncomfortable lying with a flat back like I am right now, but you can't lay on your sides, then what you can do is take some pillows like we showed earlier for back pain and put them underneath your knees like this, elevating your legs. This is going to put a little bit of flexion in your low back, which can open up some of the help with stenosis, open up the foramen there, get some pinching off of that nerve root. So this may feel good, and maybe that's all you need. You can certainly try going your feet in the other position as well if you don't like the pillows going that way. Give that a shot. Like earlier, we talked about a leg wedge. If this is beneficial for you and you don't want to keep using a bunch of pillows, there are leg wedges online, which are pretty inexpensive. Just put leg wedge, and then you can use that instead. If you are a side sleeper with back pain, obviously, if it's one-sided, sometimes you'll have to mess around with which side is comfortable to sleep on. Some things you can try is actually putting a pillow between your knees, because what this can do is keep you in a nice side-lying position like this. What can happen is if you can see Brad, he's on the ground right now. What happens with some people, if they're side sleeping, is they'll end up like this, so they get a lot of spinal rotation, and this can get very uncomfortable when you wake up. I've done this, incidentally, when I'm sleeping at night. So sometimes that pillow just keeps you in this position, and you can only go so far forward, so your spine isn't as rotated, stuck awkwardly. If you're happen to be a stomach sleeper and it gets uncomfortable sleeping on your stomach anymore, and you just can't fall asleep in any other position, I just gotta move my microphone back.
Oh, good.
That's
all you're doing.
You can try putting a pillow right around your waist region here, and it'll put a little bit of flexion in your spine then, so it doesn't feel as bad as being flat.
Emily has a question I want to talk about briefly.
Yes.
It's about the neck, though, but I wanted to answer because it's pretty simple. Can you lie on your back once?
We didn't get the McKinsey sleeping pillows for the back. Sorry. What?
Sorry, that's all right. Well, let's go through this.
What are we doing?
Emily is waiting. Turn around on your back.
What am I
flip,
doing?
prone. Go supine. Supine. There you
said
go.
4 things there.
Supine. There we
On
go.
my back.
So one thing you want to do or not do is a big mistake with neck posture while sleeping is people use 2 pillows. Can you lift your head up? So this makes his neck flex. I think some people do this because they're reading or watching TV that's up on the screen. They fall asleep with their neck flexed. Oh, no good. A thin pillow is almost always the way to do it. And sometimes if you have neck pain, you take a towel roll and roll it up like this and put it right here under the head and above the shoulders. And if it feels like, oh, that feels like good support, then you're going to take the towel, you're going to put some rubber bands or some tape. So that's your new neck support while you sleep. And if you roll to your side, can you do that, Mike? That, oops.
Oh, Jesus.
Oh, I'm going there. I almost caught his earring. Anyways, right there, that supports the neck while you're on your back or your side. And they actually make something called a sleep roll. I don't have one here, but if you look that up, Mackenzie sleep roll, they're just foam and they actually work out well.
Some of
for
them you
that.
actually wrap around your back.
Oh, that's for the neck roll. I mean, that's not the sleep roll though.
Yeah.
But it's
they
same
also
same
have-
company. What
yeah.
you can do is, if you can figure out how to get into the pillow, is take this, and I've had a lot of patients put it inside the pillow so it stays where it belongs, and that offers support like that. So, Emily, I hope that's helpful. Sorry to bust into you, Mike, and ruin
You're
your
fine.
project.
Any random questions? You guys have any thoughts on adjustable head beds make upper lower body pain worse? Some people get adjustable beds and they feel better because the leg wedge would be the same concept as having an adjustable bed. It gets you more deflection or extension. So if it's something within your budget, it's fine to do. If you can't sleep and you're having a lot of back pain, I mean, that's why a lot of hospital beds have that, so people can get some
Right.
sleep.
Before I would purchase one, if you've never slept on one or made adjustments, like if your feet feel better up, you get the bed that allows the feet to go up separately from the trunk. You'll know that'll feel better. But say you buy one and you are making the adjustments and it feels okay when you go to sleep and you wake up and oh my goodness, your back is sore. And then you say, why did I ever buy this bed? That's an issue. Then you may have to just sleep with it flat and go from there. So you're taking a risk if you've never used one before and you just jump into one and think, oh, this is going to cure my problems. No guarantees.
Cindy, the pillow thickness just depends upon as long as you're in a neutral position. When you're the same lady that asked the question earlier, you just want to make sure your neck is neutral and not flexed or too extended like this. It's going to depend upon your body type. What the thickness of the pillow is. And then when you're on your side, you can I often use two pillows on my side because the height between my shoulder and my neck are quite different. So if I'm sleeping like this, you can see how I'm going to get a kink in my neck. So again, you just want a nice neutral. So if I took this pillow, folded it in half, now my neck's much more neutral and supported. So
how you doing, Mike?
I'm ready for a nap and it's almost time to stop. So
yeah, boy, we've had a good time and we've got some really good questions. I see Mondo, looks like Chelsea has put a link for that chair that we were showing. So that was helpful.
If you have any specific questions we didn't address and you know your condition, you can just search it with Bob and Brad in the title and we probably have a video on it. And we probably have numerous videos on it.
That's right. Or you can go through and review this because if you got in late, you can go back and
yep, it'll stay on YouTube indefinitely. It'll be on Facebook for about a month and then it's gone. So
was that the same as forever and a day?
Sure.
My mom used to say that forever and a day. I could never figure out what that meant when I was like 6 years old. I thought about it for hours. Forever and a day. How does that work? Anyways, that's what happens after you've been doing a live show for 60 seconds. You can't talk.
60 minutes. Anyway, I want to talk. Next week, we'll be back at 10 a.m. Central Time on Tuesday, live again, talking about balance issues, how to improve your balance, more for the older population than the younger ones. We're not going to be doing tightrope walking or anything like that, but
we're going to show some things that can be easily modified for some of you younger folks. And if you want to do handstands, we won't go there.
I'm going to have to work on that one before.
I used to do that when I was in high school.
I got to climb my feet up a wall.
Yeah, up the wall. All right, very good. Thanks for coming. I hope you've got some good information and we got to take a break.
Goodbye. Thank you.